Good afternoon and welcome to the April 10th meeting of the Pitt County Department of Social Services Board. I'd like to call the meeting to order and observe a moment of silent prayer or silent meditation. Amen. At this time, we have no one signed up for public comments, and so then the next item on the agenda is to adopt the agenda.
Second.
No revisions needed that you're aware of?
None that I
Okay, so then it's been properly moved by Mary and seconded by Jim to adopt the agenda as presented. All those in favor, let it be known by saying aye.
Aye.
In that agenda package that you have received, we have the minutes from our March meeting. Are there any changes needed to those minutes?
I move that we adopt.
All right, the minutes for the March meeting have been moved. Is there a second?
Second.
It's been seconded. All those in favor, let it be known by saying aye to adopt the March minutes. Aye. Okay, next item on the agenda is items for consent, and we have two budget amendments, one for the LEAP, or the Low Income Energy Assistance Program, and one for SIP, the Crisis Intervention Program. No county funds involved, additional dollars from the state to true up budgets. Any questions for Jan or Angela Hart, the budget guru? If not, is there a motion to adopt the budget amendments as presented?
I so move.
And I'll second.
All right, the budget amendments have been moved and seconded. All those in favor, let it be known by saying aye.
Aye.
Okay, next, items for report. First item is to open the bids for in-home services. And I have a package here that says sealed bid, do not open. So I assume that now is the time.
Right, and that was the only bid that we received.
Okay, and in an instance where you get one bid, what happens?
We can go ahead if we believe this is appropriate and award that bid. If it's somebody that we have already been doing business with. If not, we can potentially award that bid, but we would need to go out and do our homework first. Yes.
Fair enough.
So, this bid is from Interim Healthcare, the Morris Group. Do you know that company?
Right, that's who we currently have. That's who we currently have as our service provider. Cynthia Ross is here, as is Nikki Parks, and they can certainly speak to anything about interim or any questions that you might have, because that's who currently holds the contract.
Okay, and the unit cost is $14 per service hour. I'm not sure how that compares to your current rate. Cynthia, you might want to talk to that piece of it, and then Mickey be available if there's questions.
We believe the current rate is $13.50
Okay.
is our current rate of service.
Yes.
Okay, so,
If it is appropriate and everything is in order, I move that we accept this bid.
May I ask a question first?
sure, yeah.
Y'all in a total agreement with this company?
Yes.
So the services have been good, and the slight increase doesn't negatively impact the units of service you can afford to pay for, or?
It will impact, but we each year fluctuate our services to make sure that nobody really has to be cut. We have respite services that goes along with this company as well, and those are not ongoing services. There's a piece of it that individuals get in their home every week for the entire duration that they need it annually. Then there's some other services that we budget that are short-term. They might be for a month or 3 months. And so those adjustments that we need to make when it gets towards the end of the year, they're not cutting anybody's services.
There's some flexibility in the type of services you order from the company that you can live within that new rate.
Wouldn't impact our ongoing services.
And we certainly could take this bid, review the bid internally before and bring it back next month to officially approve with a
right. Well,
recommendation. That might be since we haven't really reviewed the bid yet. But we are pleased with their services, so.
Okay, well then, as the chair, that would be my suggestion, is to give staff the chance to go through it and make sure that there's nothing in here that they have an issue with, and then just bring it back as an item for decision
Right.
with a recommendation from staff.
I agree.
Would be the best.
Does that work for everybody?
So we
Does
accept.
that work for interim and everybody? All right, then I'm going to pass all of this information to Jan so that they can go through it,
Right,
and we'll have a formal
right,
award on the next agenda.
right.
And then we have a report relative to child abuse prevention, Tammy Lewis and Monica Daniels. That's her say, I don't see Tammy, so
Probably tied up.
that's okay. Welcome, Monica. Talk to us.
Thank you. Good afternoon. I'm Monica Daniels. April is Child Abuse Awareness Month in United States. We had a Child Abuse Awareness Walk on Friday. Am I too close? Down? Okay. Okay. Thank you. Where we also wore blue. That was the National Day of Wear Blue. And the walk was held here at the county office building as well as the Human Service Building. We did make the 6 o'clock news on Friday and the newspaper on Saturday. There will also be a National Day of Prayer, which is called Blue Sunday, on April the 29th, and that was established by Prevent Abuse NC. That is a day for abused children and those who rescue them.
And we have the governor's proclamation here for child abuse
Okay, and
prevention.
You have that? Okay.
I have a question.
Yes, ma'am.
I am always so impressed when I go down Elm Street and see a sorority there on the corner of 10th and Elm displaying pinwheels as well as y'all sign. Is this something, and I've seen it year after year, is there anything in particular about this sorority that, or is it just a happenstance?
Yeah, I think they just happen to be able to get their hand on some pinwheels.
But it's always, and they have more.
And that's
women.
wonderful. We want as many people as possible to bring awareness to child abuse.
I think Teddy Bear is probably who helps them get those pinwheels and the signs and those
Yes.
kinds of things, because obviously there are lots of different organizations in the community that use those
Oh,
and
great.
during Child Abuse Prevention Month.
Wonderful.
That's great. And I'm just looking at I get distracted by all the faces I know flipping by on the screen. They walked quite a ways because these aren't pictures right out by the county office. They're out on Stantonsburg.
We did about a mile, a little over a mile.
Yeah, that's great. Fortunately, the weather
Right.
cooperated.
Yeah.
So.
And I think over in the, Brian, over at your building, didn't the health department also participate in the walk? Right.
That's great.
So-
That's great.
So get outpouring, yes.
As we stated last month and many other months, we are thankful for the work that all of you in DSS do, especially for the children and the families. So bringing awareness and raising awareness is always a good thing. So thank you very much.
Thank you.
Thank you.
Regional workshop update.
Right.
Jan Elliott.
There has been some interest, I know, in what has been transpiring with the Social Services Regional Supervision Work Group as a result of House Bill 630. You have in front of you, or should have in your packet, the executive summary of the work group's recommendations. You also have a little slip of paper if you want to go read the entire report or see any of the documentation that has been pulled together as a result of this with the web address at everybody's place, so if you want more information. The report was presented to the Joint Legislative Oversight Committee today, and of course this was informational for them. It will now move to the Department of Health and Human Services for them to actually develop an implementation plan and those kinds of things. So you can see in the summary, which does a really good job of hitting the highlights. The work group, which had 16, 17 folks appointed to it, 3 were social services directors, there were some judges, some legislative folks, some folks from the Department of Health and Human Services, so a pretty broad-based group, have been meeting now since October to make these decisions and to make these recommendations. And throughout this entire process, they were reminded that this was the entire Department of Social Services that they were looking at, not just child welfare. So they looked at what the first phase is to look at regional offices as it relates to state administration, because North Carolina is a state supervised organization. State anyway. In the other states, you would be a state employee. So in North Carolina, you're a county employee and the state supervises. So as they looked about the supervisory functions that needed to be looked at in the regional offices that the state would staff, they looked at things that they wanted to do: best practice dissemination, compliance monitoring, fiscal monitoring, working with the data systems and record keeping, interagency coordination, policy guidance, technical assistance, quality improvement, dealing with staffing standards and support, and training. And so those were the key areas that the groups would be working with at their different regional offices. There was a discussion about making sure that we were having high quality, consistent service provision, accountability, to ensure that all local agencies were doing this kind of work, and then the transparency of local agency outcomes and performance. So they talked at length about and made recommendations about how regional offices should be staffed. The first thing they're saying is that the staff in the regional offices need to be high quality, experienced, and reliable staff. There were, as I understand it, a lot of discussion about where you might pull that staff from, and the concern about whether there were sufficient numbers of staff that they could pull into the regional offices to provide this kind of support. Because clearly one of the places you would get staff would be from the counties, and so thinking about that process. The regions would have to serve all social services programs. The acknowledgement that at different points in time and in different regions you might need more services in one area than you need in another. So right now, for example, the state is in Cherokee County working with their child welfare program around some problems that were discovered there. So you might have a focus with several staff moved in that direction and not have as many child welfare staff right this minute, maybe in the central part of the state, because that may be where you pull folks from. So the flexibility was important. Each region's to have a regional director, administrative support staff, and program consultants who can provide technical assistance in every program area, as well as technical assistance that's not program specific, such as the human resources folks. Right now there's very limited human resources support for county employees. So that was one thing. Budgeting would be another, and information technology. So those are 3 areas that might not be program specific that they wanted to be sure staff were available. And they did acknowledge that some staff that are currently based in Raleigh or based with the regional offices might also be transferred into the regions to provide this support, because in fact they are doing some of that now. The consultants that come and visit us are based officially in the state office, even though they might be working out of their homes. So we get staff from child support, for example, every month coming to sit and do the kinds of things that would be done here. So that would be a group of staff that would be now assigned to the regional offices. Some of the agency's staff, trying to think, child daycare, for example, doesn't have folks that come on a regular basis. So that would be a very different plan for them, but they would now have folks that would need to be doing that kind of thing. So they're making recommendations around staffing. They did not make any decisions around funding. There was no, we were doing this, as I understand it, without regard to making any funding decisions. That would be something that would be done at a later point with the legislature and other folks involved. Although, again, it might not be as big a cost just because some of those folks are already in place. Housing these folks, you might have to have some amount of space allocated for a regional office, but a lot of the staff would probably work out of their homes and just go into the regional office for group activities or meetings, something like that. So the factors about how to divide the state into regions, that got to be, from what I gather, a very big discussion, and so the work group is recommending 5 to 7 supervisory regions. They went as high as 10 in one discussion, and I think as low as 4 in one discussion. But again, 5 to 7 regions. They did not, at this point, make a recommendation about what the map needs to look like, because there are many elements that need to be taken into account. And one right now, of course, is that the judicial districts are in flux. That's one of the issues. The other issue, of course, is Medicaid transformation and how that might impact things. So by the time this all plays out, hopefully there'll be more decisions made from that, because you certainly don't want to set up a region that has counties, their judicial district split. You'd want to have, the folks in the right judicial district. So the things that they said that need to be taken into account is you don't split a county in half. Regions should include contiguous counties. Judicial districts not be disrupted. Take a look at the total population and the population served so that there could be some comparability between. The geographic size, you don't want folks to have to travel way too far in one place, and so they need to pay attention to that. And that natural networks that we already have in place, who do we go to help us out with various projects, for conflict cases, for, maybe some training. We help each other sometimes, so they want to try and preserve those kinds of things. So that was some of the discussion. A couple of other things that were in that discussion is the military, because we have a fair number of counties that have military bases who have unique situations as a result of that. So trying to keep, not having those scattered throughout, having those kind of set in 1 or 2 regions would be advantageous, they believe, because of the type of support that might be needed. The other issue was the Native American population, and where they were and how to make that work. And one of the comments that was made in the report was that they had some difficulty, at least with the Lumbee tribe, trying to get everybody in that 4 or 5 county area in the same region based on some of the things they were trying to do. But that was something they want to believe needs to be kept in the back of your mind as you're making those decisions. Another big issue for them was how the local officials need to be involved in oversight and governance. So where do the county commissioners fit into all this, and the local DSS boards? Who do you notify about what? Who do you give the first chance to resolve problems? That kind of thing. So they kind of have come up with a timeline and said that, and again, there are 28 counties, I think, right now in North Carolina that are consolidated. I'm trying to think the right way here. They are consolidated in one fashion or another. So the remaining counties still are like us and are a single entity. So thinking through all of those issues and who you notify and when you notify them, one of the concerns that was raised because I listened to the report to the legislature this morning, and one of the concerns that was raised is that county commissioners don't feel like they always know what's going on at the DSS and might be getting, I'm going to use the term blindsided, but surprised or not really aware that there's a problem until it kind of hits them in the face. So, the work group has suggested, some ways to do that. For example, the general thinking right now is that the contract or the agreement that we're all signing will probably be signed by the county, not by the DSS director. There will be notifications initially to the local DSS, but it would move to the board and to the Board of Commissioners as things got a little more tense in the problem areas or more problematic. Some of the things that they're talking about might require legislation, but a lot of the things they're talking about could be implemented now about notification. They want to have consistency across regions, accountability for the regional offices, the oversight, how that's going to be managed. And then, of course, you've got the study that's going on right now with the group that's been contracted with, Center for Support of Families, and whatever they recommend needs to be folded in some process, some of this process also. So it's a moving target. May 2nd, they begin the Stage 2 meetings. The Stage 2 meetings are the regionalization of county departments of social services. Right now, trying to remember the date, I want to say it's a couple of years out, counties can voluntarily regionalize. They can regionalize child support across county lines and maybe have 4 or 5 agencies come together to do child support, or they could regionalize in that they totally encompass multiple agencies doing the entire program. So there are options there. There is a requirement that the Social Services Commission come up with the funding strategies for this, with the rules, because right now, the way other regional setups like district health and those kinds of things, the funding is not completely outlined in the process. So they want to have that completely outlined in the process to make sure that there's adequate funding to support the regions.
I have a question. When you said that they want, and then I see it in the report that they want 5 to 7 regional centers, and they want them in line with the court.
They don't want us to be
we have more than that we have more than one. We have more than that for the court system.
Well, what you would have is, for example, there are 3 or 4 counties in a lot of the court districts, all right? So you don't want to say that these 2 counties would be in this region out of that court district and these 2 counties be in a different court district, because that's an important issue when you're doing consultation and technical assistance, because courts operate a little differently.
Yeah.
And so having that, so that's why they're saying don't cross districts, court district lines. What they've done so far, and there's actually, at the website, you can see some of the options that they have come up with. But the options that they have come up with do not cross court district lines. They're
Because we got
together.
more than 5 to 7 regions.
There may
Well,
be
in the
2
court
districts
system. Right,
in the same
right.
region, but all of this district's counties and all of this district's counties are both inside that region.
Right. So if you've got 30-some region district court operations, you make sure that the court operation and the counties aligned.
So is the administrative officer of the court a part of the of this process?
No, they wouldn't need to be. I mean, once you know what the districts are, the districts for the court system are, then you could align your counties just knowing that it's not going to impact the district court, because the 4 counties they're serving now would be the same 4 counties they would continue to serve. They wouldn't get extra counties.
I think the money's going to be a sticker.
It may well be. The regional piece for the local DSS, as I said, the first meeting's May the 2nd. They are to meet through January of 2019, and their report is due to the legislature in February of 2019, but not implemented that early.
Are
So
you going
you've got
any of those?
No, ma'am. The legislature appointed the individuals, and this work group has 3 DSS directors, Susan Osborne, Glenn Osborne. Susan Osborne's from Alamance County, Glenn Osborne from Wilson County, and the Gaston County Director, Chris Dobbins. And that is a consolidated county. The other 2 are single agencies. So, I mean, we could talk about this a long time, but
Jan,
didn't.
is there any similarity whatsoever in the old regional office?
Yes. Yes, I did get to participate in that part of the discussion. And it's been acknowledged that we had regional offices in North Carolina through 2002, I believe it was. And so we are basically coming back full circle. There might be some tweaks about how we're doing it, but we're basically coming back full circle and providing that same level of support. Part of the issue, of course, was as the money got tighter and tighter and tighter and tighter, we received less and less consultation from the state because they couldn't travel, they had reduced their staff, whatever. So even if the regional offices had stayed in place, that would have become a problem, I suspect. If the cost, I believe that I have seen of the old regional office system was $2-point-something million. And I don't know if that was just the state cost or if that was the total cost, because you get reimbursement from the federal government based on the programs that staff was supporting. So nobody's ever told me whether that was there or not.
Really, the purpose of this is the same as the old model in terms of to strengthen the counties.
Mm-hmm.
Counties continue to maintain their autonomy.
Right.
They're just linked together, so they're linked together by that consulting group.
Right. And it allows, I mean, I talked about the fact that there were already consultants still out there, but because they're not talking to anybody across, it breaks down the silos somewhat, because the Medicaid folks aren't talking to the food stamp folks, and the problem may exist in both parts of the agency. And so the consultants, if they came together to work on the problem, could have some real impact. So it breaks down some of that silo by having them together. I know when we were working, we would actually sit in staff counties. All the consultants would come together and staff the county. How is it going in this area, this area, this area, and this area, okay? This is a strong county, good management, good leadership. They're meeting all their marks as best we could tell, because we didn't have all the automation and the dashboards that we hope to have with this. And so we might say, well, they only need a quarterly visit. But this particular county is really struggling, and they're struggling everywhere. We might want to go to them twice a month as a group to do some things. And so it gave us those opportunities. We went to boards and talked.
Sure.
We would go to commissioners and talk. Sometimes we were welcomed and sometimes we were not. We also did all the monitoring for the state on everything. That was part of our responsibility, and the training.
And you also said that at some point counties will have an opportunity to have input in terms of the grouping, or maybe be a little bit proactive with that?
The counties, right now, you can go to that website I told you about. There's an email address in there. You can give them any feedback, any thoughts you have on any of this conversation. They are accepting comments. And so at the School of Government. So certainly we have given them a lot of comments about who we connect with and
Sure.
what we think would be the best alignment. In one of the regional maps, they have us aligned with Raleigh, Durham, Chapel Hill, and then northeastern North Carolina, which didn't feel real good to me. The other map had us aligned more with the southern counties, so New Hanover, Cumberland, Harnett, going over to US 1 kind of.
So they're not looking at contiguous counties?
They are, because we would be we were at the top of the list here, and you'd have all the counties that came below us.
Southeastern as
Yeah.
opposed to the
Yeah,
northeastern.
and when we went northeastern, we went this way, but we also went this way.
So when you talk about Durham and Wake, you're really reaching out there.
Yeah, that was a pretty long reach, and, you know, we really don't have a whole lot in common with RTP, for example, in many respects, or Chapel Hill. But we also don't have a whole lot in common with, you know, Currituck County or some of those counties, because we're in a real different place, so. But, you know, it'll work whichever way it needs to work.
We're in a
We'll figure it
different
out.
place.
We'll figure it out.
We're in a
whichever.
different place with Beaufort County. I
Yeah.
mean,
Yeah, now Beaufort was with us in one group and not with us in another group. I mean, so it, you know,
it sort of bothers me that this is something else that they're fixing that's not exactly broken. There are segments that needs attention. That's the word I think is a good word rather than say it's broken. But there are areas that need attention, and rather than they look at the areas that need attention, they're looking at the whole kit and caboodle.
well,
And that's where you get into problems.
Yeah.
And that's what's been bugging me about it.
Yeah.
About it.
the idea of having oversight from a group that is closer by, who's going to be here more frequently, who's going to talk to each other, who's going to provide a lot of those services that we've been lacking for a long time from the state, again, because of resource issues. Not because the state wants to ignore us, it's because of resource issues, can help counties be more in line with policy and procedure, more in line with, you know, the federal regulations and guidelines, and give us some ideas about what's going on in other counties. We haven't had a lot of that for a while. And so from that standpoint, it's a really positive thing. My personal input to the group was they shouldn't have ever taken it apart. But
Well, and I will say that not all regional offices were created equal, and not everyone always felt like they were getting help from their regional reps. In my prior experience with both the DSS and the mental health
So
regional
if they put
model.
us with Durham and Raleigh, we're
no, we're not. It just feels like a different group. But what I will say is that is one of their big concerns right now, is that in every state that has done regional offices, they have had to work consistently to make sure that the regional offices are held accountable and that there is a structure and supervision to be sure that we're not all out doing our own thing, so to speak. North Carolina had that in the old system, but it was not as strong as perhaps it should have been.
So Jan, is it, describe that role. Is it oversight? Is it guidance? What authority do they have?
The regional offices?
Yes, will have.
Well, they will be the folks that will come in if a county is going to need to be taken over by the state.
weak.
They will be the folks that would come in and do that. They would be the folks that would do the monitoring and write the information and give it to Raleigh. Raleigh is still the official conduit to the feds, the official respondent
This
to
would
the
be-
legislature.
This would be a closer level.
This would be a closer level, right, an intermediary,
Supposedly.
so to speak.
Because-
And one of the questions this morning from one of the legislators is, are we just building additional, I'm not, bureaucracy is the best word I can come up with. I can't remember exactly what
Another
he said.
level in the,
Yeah.
in the chain.
And that was acknowledged that in fact we were, but that it had some value.
Absolutely.
Well,
Yeah,
my
it's-
concern is that what happens to social services in North Carolina doesn't end up like mental health, because there was a good mental health system here. And rather than to take it in consideration and look at why it's working real well here, it's just broke up everywhere. And you, counties and people did not have choices.
Well, and they made it very clear the regional offices would not be service delivery organizations.
Sure.
So,
Were
they
they
are
before?
consultants.
Were they before?
No, they were not.
I didn't think so.
But some folks have had that sense that they could actually go out. And at one point, there was some discussion about, well, they could be doing the MAP training, or they could be doing some of those kinds of things. So that took them into the service delivery arena, but they backed off of that when they made their final recommendations. You do have a copy of the letter from the Center for Supportive Families, who is the consultant that has been hired by the state to study social services in North Carolina and make recommendations. And so all of that's got to get factored in also. So it tells you a little bit about what they're going to be doing while they are here. They are already on site. They've already hit the ground. They're going to be documenting funding, staff, organizational structure, define specific structure and accountability, provide specific recommendations to enhance state office support, develop social services transparency and wellness dashboards. So there will be a dashboard that says how we're doing in every area that's being measured, that anybody can go out and look at it anytime at some point.
Anyone, the general public,
Yes,
and
right. Developing a plan for continuous quality improvement, detailed child welfare reform plan. They are going to be reaching out to counties to collect local staffing data, organizational charts, turnover rates, that kind of thing, so you can see that in the letter. Performance data, they're going to be doing focus groups, interviews, best practices from other jurisdictions. So that is what this group is going to be doing. They have a short initial time span to get some of this done, and then they'll have some longer time to do. So it's going to be done incrementally also.
I don't know what meeting or where I was when they talked about these multi-activity centers. What was it called? Family, was it Elements that has one of those? Like you go to this place and you can do different kind of social service kind of activities at this center. That's what I thought they're going towards. I wish I could think of the name of it. But I've heard so many new things as it relates to social service. I'm curious to know what it's going to look like.
Yeah.
But they have centers, and I don't know what county it is west of us, where the general public goes into this, I want to call it a mall. And they, you go, and you don't have to go over anywhere for food stamps, and you don't have to go somewhere else for Medicare. You go to the center, and there is accessing all of the services at this social service mall is what I saw it as. And whether or not that was the real thing or just a pie in the sky that they was dreaming, I didn't know.
Well, a lot of counties have all of their county DSS services in one agency. Some also have health built into the same building. Some also have aging services in the same
What are they calling
building.
those? I can't
Human
remember.
services agencies is what I'm hearing, but they're different ways, but it's the building and how they structure it.
Some people, Mary, call them community resource centers, which is kind of a model that, like Jan says, that everything under one roof.
Yeah, that's what I'm talking about. It was,
Onslow
A mall
has just done
shopping.
a little bit of that with their new building. And that health, social services, aging, some of those things are all in one building, so they can refer people back and forth without them having to leave the building. So, anyway. The written agreement is being responded to again, so we're looking forward to another draft of the written agreement that we have to sign by July 1. I haven't seen a more recent copy than the one I saw on March 1. So that's where that stands. So we're looking forward to all the things that are
All the
changing.
upcoming changes.
That's right.
Any other questions for Jan relative to the update on House Bill 630? Okay, the next item is meeting with area legislative members.
We've talked a little bit before about possibly having a meeting with our delegation to talk about social services issues. in North Carolina and specifically Pitt County. And so wanted to think about if you still want to do that, when we might want to do that, and what kinds of things. I mean, I have a list of things, but the kinds of things that we might want to focus on. The county is having their legislative breakfast with the commission, with the legislative delegation on April the 27th at 8 o'clock. The library is having their breakfast on the April the 30th. That's why I brought calendars. The session begins on May 16th. We could have, breakfast, lunch, dinner. We could, do a variety of things. So I guess the first question is, do we want to try and do that this year or not? Because time is growing close.
Well, and have you asked to be an item that the county also puts on their list
I
to
asked.
have at their breakfast? So if,
Right. We talked about the possibility of a joint activity first, and that does not appear to be the right thing to do. I have been invited to participate with the commissioners group around specific issues that they are having, that they want to bring to the legislature around social services like unfunded mandates and some of those kinds of things. So that is that piece is going to be done. I just need to let them know.
so as long as we're a part of that one as well on county-specific issues with DSS. I don't want it, to me, it doesn't make sense for us to meet with them and say there's these issues if the county doesn't also
Right,
support us
right,
and say there are these issues.
Right.
So
Yeah.
maybe they need to hear it initially from the county
Right.
in a smaller setting, and then and you can learn more about this at your meeting on blah
Right.
with the DSS.
Has there ever been a session? Well, I know the possibility of the structure of the county commission may change, in this way. But has there ever been a session with social service board and the county commissioners? Because this current group tend to think that the department, your department, Jan, gets quite a bit of chunk of the budget, and I don't know whether they approve or disapprove, but sometimes they seem like they approve and sometimes they seem like they disapprove. But has it ever been one, because you've been here longer than a half.
In the 20 years I worked for the county and would have been in those meetings, and in the last 5 years while I've been on this board, I would say no.
I know it
That
hasn't
is
since
not-
I've been here,
Yeah,
but
well, and it didn't
I'm
happen.
thinking something
I
else could
attended all of
happen.
those meetings from a staff perspective, and I don't remember ever going to
I
one.
think it may be beneficial if, well, I don't know what the board is going to look like after May 8th, but at some point down the road, and not too far, there should be at least an enlightenment as to the activities and what involved, and social services beyond just welfare.
I think that's good.
And I think they need, we need that kind of enlightenment. I think that's a good word, enlightenment. And then maybe there can be some better understanding as to what really goes on within social services.
I would hazard that most county commissioners over the last 25 years have learned what they know about DSS, either because they were the rep on the DSS board, or they got a 10-minute presentation in a budget workshop. And that's not enough.
And that is definitely not enough.
Right.
Right. Just from my perspective, if that's okay, I think that would be a wonderful idea. We might want to wait until the elections
Yes.
have been done and the new board is probably sworn in.
Yeah, but that's
Much later.
December.
I know, but, I think we got some contested races,
Depends
so.
on the whether or not
Yeah, if,
the bulk of them are incompetent,
right.
Incumbents or not.
So, but that's something we should be thinking about.
Yeah, I think that's a good
And maybe
idea.
that's something you can approach with the manager. Because no matter what, he's the person, that's the go-to person.
Right, right. I think that's a good idea.
Yeah,
So we can-
just a suggestion.
Yeah,
Good suggestion.
Yeah.
I hear some comments every now and then.
We are doing our budget presentation on the 26th at 8:30, if anybody wants to join us in April.
Well, you know I'll be there.
I know you'll be there. That is when we will have our conversation about our budget. And I will give you a heads up that we were to take our budget back to this fiscal year's spending level. So I will be having a discussion about not doing that, but that is what the instructions are.
Aren't there 3 different types of pots of money, right? You have the county, then you have the federal, and then you have the state. And it might be good to have that clarification in this meeting that I'm talking about, because
Yeah, right. Well,
all
and
the
we
money
do
you
that.
get does not come out of one single pot.
And we do that in our annual report, and we have done that when we've done our meetings with the commissioners. Every time that I stand up, I talk about what's federal, what's state, and what's county. So only 10